Welcome to this edition of the eClinicalWorks podcast. I'm Adam Salati. We often hear that providers are trained to care for patients, so it's no surprise that many independent practices struggle with the vastly different process of the day-to-day operations of running the practice. One of the biggest benefits to practices in this situation, whether they're small independent practices or just starting out, is some expertise in the billing and collections side of the operations of the practice, which is where revenue cycle management services from eClinicalWorks comes into play. Here to speak with me today about how this revenue cycle management service has played a role in his ability to get his startup off the ground is Zakary Call, Psychiatric Physician Assistant and lead provider at Phoenix Pointe Psychiatry. Zachary, welcome to the podcast.
Thank you so much for having me, Adam. I appreciate it.
Well, it must feel good to have that title, lead provider at Phoenix Pointe Psychiatry. Tell us a little bit about how you got started.
Yeah, so I've been working in the field of psychiatry for a few years now, and just realized that particularly in the Arizona region, that there was so much need for psychiatric patients to get in and seen really quickly. So me and my wife started Phoenix Pointe Psychiatry as kind of like a side hustle or a side job while I was working a full-time job as well, just to provide those patients that quick access to services that they're needing. And since then, it's been growing and growing rather quickly, if I do say so myself. We started back in June. I was able to quit my full-time job in December of last year, and now me and my wife are running it full-time.
Boy, from startup to independence in 6 months, I think that sounds very quick to me. What was your experience with the revenue cycle management services? How did you decide to start out with that? Because I think a lot of practices try to minimize their expenses at the outset. I'm sure this was something else that, there's a cost for the services. Why did you decide to take that leap, and how did you find out about it?
Yeah, definitely. So I have some experience with eClinicalWorks through previous jobs and through my schooling and everything. So have really enjoyed the eClinicalWorks electronic health record aspect. I find that it's really easy to use. So I knew that I wanted to use eClinicalWorks when I was in the talks of starting my own practice up. And then while I was going through the setup process there, I learned that you guys offer some really amazing revenue cycle management services and billing services for a cheaper price than I could find anywhere else out there. And that's really what made me decide to go with it.
So let's find out about where you happen to be now, right? Let's level set a little bit. So you're a newly established bootstrap practice. I think it's safe to say that. You subscribe to eCW's revenue cycle management services. What does your financial picture look like at this point? I'm going to list a couple of metrics. How about that? And you tell us where you stand on those. First pass acceptance rate.
First pass acceptance rate is up around in the 90s. I believe it's like 97, 98% first pass acceptance rate, which is
That's
huge.
very good, yeah, especially for a startup, right?
Yeah.
That could be one of those stumbling blocks.
Yep.
What about net
Mhm.
collections?
Yep. Net collections are 98 or above, depending on the month, which is another, just unheard of figure for practices out there, especially small practices that are just getting started and trying to figure out all the back end of how insurances work and how to actually get reimbursed. So to have, just in our first 6 months as a startup, having 98% collections is amazing.
And what about average days in AR?
The average amount of time that it takes for us to actually see the patient, have a claim submitted to the insurance, and get reimbursed for it is right around 2 weeks, 14 days, I think, to be exact. So exactly 2 weeks.
That is, I
Um,
think all of those metrics are things that even very large practices with a lot of experience, I think they struggle to meet a lot of those goals on their own without
yes.
the tools and expertise that revenue cycle management offers. How does this, I mean, I think you mentioned how this compares. This is the not only a sounds like very effective option, but one of the cheapest options you could find and that you considered. But we've heard reports from practices that come from other systems to ECW. We hear that they said, they thought they were signing up for full revenue cycle management in some other system. But instead, they found that they ended up doing almost all of the work themselves. What have you had to put into this process? And what do you get from eCW's RCM Services team?
Yeah. Well, I'd say that probably the very best compliment that I could give the eClinicalWorks RCM team is that it really doesn't require much time or thought on my end at all, which is the most important thing. Being a CEO, a chief everything officer at a small business startup, that you're having to do everything. I'm having to schedule patients, make phone calls. It's just me and my wife running the whole thing without a bunch of support staff. So the most important thing to me is having billing almost completely taken care of, which is what the eClinicalWorks RCM is able to do for the cheapest price that I was able to find out there anywhere. So when I was doing some research and we'd first started, other billing companies were charging 5, 6, 7, 8%, and currently the eClinicalWorks RCM is just at 2.9% of collection. So that's the cheapest option out there by far. And many of these other companies that are charging that 5, 6, 7, 8% are just doing the initial claim submission. They're not doing follow-ups. They're not following up on denials, which the eClinicalWorks RCM is doing. I mean, it's really cool to see when I look through the back end of all these submissions that are going on, is they're having call after call, they're having denials occasionally, and they're calling to follow up and getting it submitted. And really, as long as I'm doing my part, which is really simple, of just making sure I'm collecting the co-pays, and making sure that I have uploaded actual scanned insurance cards, then that allows the eClinicalWorks RCM team to just go full steam ahead, and they're fantastic.
So they are obviously submitting the claims for you. You mentioned that they are processing the denials, communicating with the insurance. I think you also mentioned previously that they do help you with credentialing. They've helped you with that part of the process too. Can you talk about that?
Yeah, definitely. So I'm not going to say my account manager's name because any new people are going to try to steal it from me. But she, initially through the startup process, we have weekly meetings with our account manager to make sure that I'm learning everything that I need to do, and to go through, our numbers and how billing is going and all that stuff. And I was having a lot of issues while going through this process with my credentialing company that was just really difficult to work with, and they were having issues with following up with credentialing things. And my account manager through the eClinicalWorks RCM just said that she was tired of waiting and she's going to go ahead and submit some applications for me. And I really truly believe that she has done better for my credentialing, which is outside of her job role, than my whole credentialing partnership was doing for me. So that's something that you guys have gone above and beyond with.
Oh, that's good to hear. And maybe they'll have to look into adding that as a more official service there for RCM.
Yeah.
What's that working relationship like, and how often? I mean, you mentioned in the beginning it's a weekly contact. How often are you in contact? Is it regular? And do you have good visibility into what kind of work is being done?
Oh, yes. So like I said, you meet with your account manager once a week as the billing process has started, to make sure that that I'm uploading the insurance cards correctly, and I'm processing copays correctly, and and then after I've finally gotten my feet under me a little bit, and knowing, how to work the system and how to view the numbers and everything like that, then you can kind of move back. So now I'm meeting with my account manager just once every 2 weeks, and it's been fantastic. And if I do have any issues that arise, she's easily reachable by a phone call or email. Yeah, it's been wonderful, and I have definitely needed a lot of hand holding through the process, and you guys have held my hand very well.
So we talked about the impact that this has had on your actual revenue cycle and operations in that regard. But is there any spillover? What impact has this success here in revenue cycle management? What impact has this had on other areas of your business and your practice?
Great question. So again, the most important thing is that taking billing out of my responsibility has allowed me to grow the practice. And I wholeheartedly believe that using the eClinicalWorks RCM has allowed me to quit my full-time job and do my own practice full-time with just in 6 months. So I think that if I was having to spend so much time and mental power on having to deal with billing, then I wouldn't be able to work on the extra things like growing the practice, seeing the patients, providing um, that extra level of care that we promise to our patients. So yeah.
That's great to hear, Zach. I'm glad that it's been working out so well for you. Hopefully we get to continue to work with you as your practice grows even further into the future. Thank you so much for taking the time to be here today and to share your experience with us.
Thank you so much for having me, Adam. I appreciate it.
If you'd like to learn more about revenue cycle management services from eClinicalWorks, go to my.eclinicalworks.com to learn more. Also, don't forget to check out our other eClinicalWorks podcast episodes on YouTube, Apple Podcasts. Now we're on Spotify, many different platforms, wherever you find your podcasts. And of course, my.eclinicalworks.com is a great place to find us as well. Be sure to like, subscribe, share with your friends so that they can hear a lot of these great topics that you're watching and listening to as well. For the eClinicalWorks podcast, I'm Adam Solati, and thanks for watching.